caregivers. And one of Chris Wilson, who has been doing a lot of storytelling workshops for us, just did a storytelling workshop at the PCORI annual meeting. And she closed the workshop with this quote that I love from Maya Angelou that I asked her to give me, which was, "There is no greater agony than bearing an untold story inside you." And so I think this is really one of the themes of what we're doing and coming together, and also the way that stories can help motivate change, and so I'd like to turn this over to my friend and colleague Rebecca Kirch, who has become who has had a lot of experience in the last year, little more than a year, as a caregiver, and she's going to tell you a little bit about her personal experience as a caregiver.
There we are. Well, I've already ruined the reveal. I am so happy you're all here. Is this the right place to hold it?
I think so. Yeah.
We are so happy you're here. The whole team has been anticipating your arrival for weeks. And it's just thrilling to have all the faces in the room that we can associate with the email address string that's been, front and center for all of us. This is about storytelling, and I wanted to share a little bit of mine as the icebreaker, if you will, to dive us right in to what's coming up next. Here's my family. My very handsome husband that I met on an airplane in 1991, and it was a super short shuttle flight between Newark and Boston, so I was very efficient. Because I went home that night, I didn't know his name, but he had an accent, and so I told my dad, I met the man I'm going to marry today. I don't know his name, but we'll call him Sven. His name is actually Eric. He's Norwegian, the love of my life, and then we've had two beautiful boys, Thomas and Henrik, and every year we celebrate our family at Emerald Isle. So this is us 2 years ago at Emerald Isle on the pier. A couple months after this picture, as I say, bam, Eric started having tingling in his legs that worked its way up, and so our journey began. We were frequent flyers of the health system already. He's actually had 3 kidney transplants, but a big tennis player, so none of that kept him down until this. It was a neurological issue, clearly, so we started seeing specialists to try to figure out what the heck's going on. It turned into fights with insurance around diagnostics. Prior authorization. Anybody ever experienced anything like that? Right? Prior authorization just to get the MRI in order to figure out, why is my husband suddenly staggering instead of walking? Why is my super good tennis playing husband, who's a lawyer in his other life, not able to do that proper serve? We finally battled and won the prior authorization fight so he could get an MRI. And he was sent directly to the emergency department because he had inflammation in his spine. Long story short, this was an undiagnosed inflammatory process that caused neurological damage so that he can't feel where his legs are in space. He could still walk and live, take care of himself, but it was slow and unsteady. Then the unthinkable happened in that he fell and hit his head, which was my worst nightmare, that he would fall and hit his head, and sure enough he did, ironically on the way into physical therapy. So then he had a traumatic brain injury on top of whatever neurological process was happening. So we spent 4 months in and out of various hospitals to try to diagnose what was the culprit here and whether there's treatment, and then to start his rehabilitation process. So he was in hospitals for diagnosis and multiple tests. Then the insurance company was a little more generous. As long as you're trying to figure out what's medically wrong and you're in the hospital, it's much easier. So I guess that fall was a blessing, but that's a sort of strange way to think about it. He then moved from the hospital to the rehabilitation hospital. And then the fight began, is he having enough progress that we can keep him there? Or are they going to make us go to a skilled nursing facility where there's very little rehabilitation? Because by then he couldn't walk, he couldn't toilet on his own, he was completely dependent. And that wasn't the lifestyle we were used to. So we needed some help and support to figure it out. So an engineer came to our house. One of the fun amenities now is we have this chairlift, which my son Henrik thinks is super cool. I don't think I can play it as a movie, but it is a movie where he talked. Oh, there he goes. I asked him, how is it? And he says, give me a minute. It's a real thriller. Goes a whopping 2 miles per hour. So there were some fun bits. You have to keep your sense of humor. But what we've learned is there are so many surprises that are completely unexpected. I've been in the healthcare place for 20 plus years in my career. So I have a Rolodex second to none and quite a bit of sense of what's going on. I was useless, hopeless, helpless in figuring out what do I need to bring my husband home and support what our world looks like now. I got that emergency room surprise bill. It turns out when he had that bleed, he had an MRI, but it was an out-of-network doctor. Now, when you're in the middle of a brain bleed, you don't go asking, is my radiologist going to be right out of network? Still fighting about that with the hospital. And we got all the other the hospital keeps messing up on its bills, so it keeps rebilling us, and they say some of his rehab's been out of network, even though the hospital's in network. And all of those mistakes that they make, they're on us to fix. They're not going to take the responsibility to go back and figure out what they did wrong. So think about the time, the energy that we all have to devote to these sorts of problems. Just tons of surprises on top of the experience of trying to bring someone home and have somewhat of a normal life with our kids and our family. And what struck me the most is, I think, these utilization processes and the insurance coverage benefits, there's nobody, unless you have case management, to help you find your way. And Becky and I had the privilege of going to Patient Advocate Foundation's mothership a couple of weeks ago to experience firsthand people like me calling in who feel helpless, hopeless, powerless. And the hand-guiding care was so incredibly, it was an intervention in and of itself. Even if you had said, gosh, there's nothing I can do for you, the way that you talked to people and validated the challenges and the problems, that in itself is such a comfort, let alone the way that you steer. Everybody needs that, right? So that's something I sort of learned firsthand. And I wanted to share with you a little bit of the lessons we've learned. So Eric is learning how to walk again. Here he is in an exoskeleton. It's slow but steady progress, thank goodness. And he's more determined than any Norwegian Viking I've ever known. We got a beautiful dog named Eigen, who has been the love of our life as an incredible escape from all of this. And he's been a true, true joy. And we got a Manny, Usman, who he's from the Ivory Coast, and in his French accent, he will say, anything for you, Rebecca. Best thing ever. Because he helps with the kids, with my husband, and I feel safe knowing that Eric's not going to fall, not going to hurt himself when I'm here with all of you. But here's what I learned through this whole process. Everybody, people, health professionals, health systems, insurance, everybody's conditioned only to talk about your medical condition, not about the circumstances surrounding your condition, right? We need person-centered care to be the name of the game. And that means thinking about the person beyond the disease. Think of the complexion of my family in terms of what our landscape is. I have 2 little kids that have to be at school. I have a dog and a cat and a husband and all these things, and I have medical debt now, and my husband can't work. So everything changed in an instant. Nobody asked me about any of that, or what kind of help do you have at home, or I had a panic attack. It was the scariest thing ever. I told Gwen about it after it happened. I had to pull over after I dropped my son at school. So the caregiving role also really freaks you out. I wasn't sleeping or eating. I had lost 20 pounds. Sadly, I gained it all back. But it's incredible how you're foisted out there to figure it all out on your own. And I thought to myself, what do people who don't have the contacts and the support that I do? Well, they call Patient Advocate Foundation, if they can find their way and be lucky enough to find us. But we're not enough. People need curated information and navigation to help make the right choices for them about their insurance coverage, about utilization review when insurance tries to say no, and about appeals processes, and how to use your benefits to the best of your ability. So that's something we know that we are laser beam focused on at Patient Advocate Foundation, and our policy choices from the NPAF point of view and the advocacy we do is centered around all of these concepts. And that's so gratifying for me, because there is a place for all of us to do our part, to tell these stories and share. The Hill staff need to understand, the community partners we have need to understand the real plight of real people in terms of what it means once you've been diagnosed with a serious illness. And here was the kicker. It's really socially isolating. It's very lonely to be a caregiver, because your whole life changes and suddenly this active experience you had where you could go anywhere and do anything, you're stuck at home, you're tethered. And for me, turns out I'm an extrovert. It's been really tough to just be home. That's why the dog has been such an incredible delight. He jumps up on the sofa and we watch movies together. Caregiving is also one of the biggest presumptuous elements of our health system. The health system sends you home from outside either the doctor's office walls or the hospital walls without any regard for what's the support system you have when you leave here. And you have to piece it together on your own. It's the single most significant and unquantified cost-sharing contribution that all of us who find ourselves in that role and foisted into it make. So these are some of the lessons I've learned. I've seen nodding heads as I've talked about it, so I think these resonate as a trend, not just anecdotal evidence. So I've been thinking about it a lot in the context of the role that I play within National Patient Advocate Foundation. Health policy has been a pillar of my life professionally and personally, but now it's extra super personal, like it is for all of you who gave up the time to be here. And so I've been thinking about what are the policy directions that we need to go, and we'll be hearing about some of that throughout the course of this afternoon, but I want to make sure that all of us use our shared strengths to truly bring person-centered care everywhere. What does that mean? That means, how do we help treat the person beyond the disease and help give people the words to use to get the care that they need? That's a policy issue. That's an advocacy issue. It's a personal issue for all of us. See me, not just what's wrong with me. I want to make navigation a real thing. And what I mean by that is there are a lot of words that are used to describe the services that Patient Advocate Foundation case managers supply and patient navigators supply, but it's not a field yet that's recognized and validated the way that different health professionals are. We need to change that and make it an essential aspect of care. That's going to take time, patience, and grit, but we've all got that. Not the patience part, we have persistence. We want to build public demand, and that's where all of you are especially essential to come in and help support this series of strategies. Community work is going to be essential to give everybody the words to use, to talk about what person-centered care is, to demand it, to make it real, while we're working to make patient navigation equitably accessible to everybody. And finally, let's aim high. This is about what can we do to change the world, and we all need each other to do it. And so that is why I'm particularly excited. Nicole's right, this is going to be the best patient congress ever. We have this incredible team in all of you, in all of the staff that wants to help make it as easy and pleasant and exciting as possible. And we're in it for the long haul here to make sure that we really help support what patients and families most need. So I want to thank you all for being here. I know you all share versions of this story, and I appreciate you listening to mine. Thanks.